guys, we're going to go ahead and get started. Now that we've got you all fed and watered and your bellies are full and you all remembered to come, hopefully you won't take a nap during our seminar. And forget that where you are. Think you're at home in the bed. So anyways, well, welcome. I'm so glad that all of y'all are here with us today. For those of you that I don't know, my name is Emily Russell, and I head up the marketing department. It's just me, but here at Clearview. So, and part of what we do is we do outreach to all communities. And this event is actually put on by our Senior Circle program. And some of you guys are probably already members of that, and you receive newsletters on a quarterly basis. If you don't, and you would like to receive that newsletter, just let us know before you leave today, and we'll get your information and get you added to the list, okay? It's free of charge. Right now, I think eventually there'll be a fee with it, but it'll be very minimal, and we feed you once a month and teach you something great, so it's well worth your time. So anyway, so welcome to Clearview. I'm sure all of you guys have been here at some point or another, hopefully just visiting somebody though, and hopefully you weren't a patient. So welcome back for those of you that have been with us before. Today we're going to be talking about a very popular topic, as witnessed by our sheer turnout today, dementia. So how many of you guys are aware of dementia? How many of you guys are afraid you might fall into that trap one day of dementia? Exactly. I think we all are. We all are. But good sign. You guys all remembered to come today. That's very good. You remembered where to come to and remembered the time. So we're in the right direction here. So that's a very, very good thing. So I have two lovely ladies with me today that are actually going to be presenting on this topic for you guys. I have the privilege of having a relationship with the University of Georgia Health Promotion Program, and these two students just recently graduated from the University of Georgia with their degree in health promotions, and so they are spending the summer with me learning the ropes, and so they've been researching hard on this topic to present this information for you guys. By no means do we profess to be experts. You know, a physician is always ask your doctor about any questions that you have, but at least maybe we can give you guys a little glimpse, a little snapshot into dementia, some of the warning signs, some of the things to look for, and then hopefully some prevention topics as well. So I'm going to let these lovely ladies introduce themselves, and then we'll get started, okay?
Hey, my name is Kathy. Like she said, I'm one of the interns, and I just want to let y'all know that June 9th will be the next Lunch and Learn, and it's going to be about skin prevention, so I hope to see y'all out for that one as well. But
skin cancer prevention. So we're going to be doing some, we're going to have some samples of some sunscreens and things like that, and just be talking about skin cancer prevention.
So I guess it's my turn. I'm Savannah Howard, and like she said, I'm also an intern, and I'm going to be doing today's presentation on dementia. Like she said, I'm not an expert, so I'll try to answer questions. If I can't, we'll definitely find you somebody who can answer the questions for you. Has anybody not gotten a handout? Everybody got one? Okay, the handout that you have is just going to kind of go along with what the slides say and help kind of if you want to take some of that away, if you want to write down some notes. There's a really good website that we're going to get to later that is on there. So we'll go ahead and get started. Like she said, this is dementia in the aging adult. Okay. So dementia, a lot of people can kind of get confused with Alzheimer's or some of the other terms that kind of all run together after a while, but really what dementia is just an umbrella term for any loss of cognitive ability, and that is a chronic and progressive disease, and it's caused by a variety of brain illnesses. It can affect memory, thinking, behavior, it can affect judgment, and just the ability to do everyday tasks. There's two categories, and some people don't really know about the reversible type. A lot of us do know about the irreversible type, but we're going to talk about both of those. The reversible type of dementia is from this is a good mnemonic to use. It can be from a drug interaction that you have. It can be from emotional disorders, metabolic disorders, eyes and ears problems, nutritional deficiencies, tumors, infections, and they usually go away. But then the most common that we know about is the irreversible types. And a lot of us know about Alzheimer's disease. That's one of the most common types. And there's also vascular dementia, dementia with Lewy bodies, and there's multiple types. These are just some of the common ones. And if y'all have questions or comments, just chime in whenever you have something to say.
Can you go back? Did it say Parkinson's falls under the category of dementia? Okay.
Yes, it does. So it's kind of confusing, but dementia is caused by brain illnesses. These are brain illnesses, and so technically they cause dementia. So that's why it's kind of the umbrella term that is over these illnesses. But it's one of the irreversible types, and there's a lot more.
That mixed dementia, what would that be?
You know, I'm not completely positive about all of them, but I think that the mixed dementia would just be if you had multiple of these. If you had Alzheimer's and vascular dementia, you would be categorized as mixed dementia. But all of these diseases, they cause different types of brain illnesses, different types of memory loss. There's very specific kind of illnesses that they cause, but they're all under the category of dementia. Any more questions on this side? So Alzheimer's, I kind of wanted to hit on because Alzheimer's is a lot of times confused as dementia, or people think they're the same thing, but really they're not. So Alzheimer's, like it says, is the most commonly known and likely to cause dementia. If you get Alzheimer's disease, there's a picture of what your brain begins to look like, and basically there's fibers in your brain that begin to basically disintegrate, and that causes dementia. So they're kind of confused, and they are kind of similar, but they're not the same. Anybody got questions on that one? So is it inevitable? A lot of people think that it's just kind of a matter of time. It's going to happen to us one day, but it is not, which is the good thing about this presentation. You're not all going to get dementia. But what it is that it becomes more likely with age. So as you get older, it's more likely that you may have a brain illness, or that you may just have basic memory loss, but it's not inevitable. Because it can be from brain damage or brain illnesses, not everybody has that. But the older you get, the more common it is. And then the graph there is, I thought was kind of interesting because it just shows how common Alzheimer's is. The top solid line. So it shows, that's why I think they're kind of intertwined sometimes, because that's the one you hear about the most. And the global impact. So dementia is obviously worldwide. 47.5 million people is the estimate for how many people in the world are living with dementia right now. And then the bottom statistic is kind of scary. It's on your handout as well. The total number of new cases worldwide per year is 7.7 million. So that is a huge number worldwide, and it comes to be about a new case diagnosed every 4 seconds, which is a little bit scary, but there are prevention methods, and like I said, not everybody gets it.
Well, not all parts of the world would be equally affected.
Right, right, probably. It does have to do with family history, so that could be a huge part. If a smaller country didn't have a family history of it, wouldn't be as prevalent. But it is, it's not. I would say it's pretty even spread around the world. And then in the United States, we spend a lot of money on dementia because it's a huge problem and health issue in our country. So the graph that's shown here just shows how much money we spend on dementia health care as compared to the revenues of Walmart and ExxonMobil. So it's a huge economic, it has a huge economic impact on the United States. And then a little statistic there is that it's estimated that 5 million people 65 years and older have Alzheimer's alone in the United States. So since Alzheimer's is just a small part of dementia, it just shows you how prevalent it is. in our country. So some risk factors, kind of going back to if it's even across the world. Age definitely affects it, because as you get older, it's more likely that you may have a brain illness or brain damage. Heavy alcohol use, like I said, family history. Unstable blood pressure can definitely affect it. High LDL cholesterol. Go ahead. So LDL cholesterol is your bad cholesterol. High levels of that can definitely impact your brain health. Diabetes, high estrogen levels, obesity, and smoking, and these are just a few of the more common risk factors. But kind of like nowadays, almost everything can bring an illness, so these are just some of the common ones.
When you're talking about family history, then it is, you can get it.
Yes, so
What I'm trying to say. Yes, hereditary.
yeah, it is. It can be inherited. So if your mom and your dad and your grandparents had it, it would definitely be more likely that you would eventually develop it. But you know, there's always prevention methods and steps you can take to try to prevent that. But it is a factor. So warning signs, you can kind of tell when somebody is becoming into the stage where they're starting to get dementia or another type of brain illness. Some warning signs to look for are obviously memory loss that disrupts your daily life, trouble planning or solving problems. So, you know, if they just kind of forget how to plan out their day in a reasonable manner. Difficulty completing familiar tasks. So if they don't remember, you know, how to wash the dishes or how to wash clothes, just simple everyday things can be a sign. Trouble with spatial relationship, speaking or writing, decreased or poor judgment, because it affects different parts of your brain that involve judgment. Withdrawal from work or other activities that they would normally enjoy doing. And changes in mood or personality is a big part of it. Okay, so this is kind of a cool website that I'm going to go through with y'all. It helps you calculate your risk, and you can do it for yourself or you can do it for somebody else. So I'm going to kind of go through this and kind of get some input from y'all on how the answers go. So let's see if this will work. All right. So this is the website, and you can all do this from home. It's on your handout if you want to look at it later. But we're just going to go through it real quick. It's a really quick tool, easy to do, and has a great assessment response at the end. So we'll click continue. And so we're going to say we're taking this as a self-assessment today, but you can also take it for a friend or relative if you have concerns about them. And you can skip that part if you want to do that. All right, so this is a memory test, and it has a part later on that we're going to look at too. So just watch this. All right, so that part's over. Let's see if I can get this to work. So what's our primary preferred language? I guess we'll go with English. So average age, does anybody want to volunteer?
70.
70, okay, perfect.
Every day
All right, 70 years old, male or female?
Yes.
We'll go with female. And let's see if we can go with an average height.
What is your height on the assessment?
We'll do 5'5". Weight, let's see. I can drag this. We'll try to do an average weight. How many years of school? Does anybody want to volunteer theirs?
14.
14, that's a good average. First degree relatives with dementia or severe memory loss. Does anybody have a first-degree relative?
I did.
You did?
Father.
So let's just go with yes and see what our results are if we do have a family history of dementia.
Now, if you have like grandparents or an aunt, that wouldn't be first.
I guess it wouldn't be first degree. I would consider first degree mom, dad, maybe brother or sister. But it probably wouldn't hurt to add them in there and just consider them first degree just to be on the safe side. So history of stroke. Does anybody want to chime in? We'll just put, we'll put no. Many strokes? No. Traumatic brain injury? Knocked out for longer than 5 minutes? No. Epilepsy?
No.
Parkinson's? Normal pressure, water on the brain? It's probably not. All right. Brain tumor or brain cancer?
No.
Other brain disorders? Well, good. Y'all are doing good so far then. All right. Hypertension, high blood pressure?
Yes.
Are you taking medication for it?
Yes. Yes.
High cholesterol?
No.
Yes.
Yes and no. Are you taking medication for it?
Yes.
All right. Diabetes?
Yes.
Medication?
Yes.
Okay.
Oddball, I don't have none.
We'll go with, let's see. We'll go with 0 just to be safe on that one. Smoking?
No.
Some yeses, some no's. More than 100 in your life? Anybody? Maybe? We'll go with no. Okay, this says, which of the following best describes your current physical activity level? So we have low, moderate, or high?
Moderate.
Moderate. On average, how many hours a day do you spend engaging in mentally stimulating activities?
6.
6? Okay. All right. Do you have severe memory problems?
No.
No. Are you nervous?
Yes.
Yes. And then how much of the time over the past month have you felt downhearted or sad? Let's go a little. Some, a little. This is, now we're finished, so, well, I think we're almost finished, maybe. Okay, so just yell out if you think this was on the first slide they showed. Yes or no?
No.
Yes. No.
The first slide said.
No.
Yes.
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 No?
No.
No.
Yes.
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 No.
No?
No.
Yes.
Yes?
No.
Yes.
Yes.
Oh, fine.
Okay, then I'll just, mine is real fast. Oh, maybe not. So it's pretty quick, and I did this before, and the memory part is kind of tough. Well, maybe our computer's not going to cooperate.
Yeah.
Oh, it's loading.
That distraction is everything else that she did.
Maybe it's loading. Oh, there we go. Okay, so this just gives us a quick kind of synopsis of what your results are, and I don't think I'm going to read through all that, but it kind of gives you in detail kind of what you can do to help, what are your main risk factors, if you can modify any of those to help lower your risk for dementia, and it puts it out pretty easy, and it's quick and easy to do. So that website is on your handouts if y'all ever want to do that for yourself, if you want to do it for a loved one or a friend that may have concerns. That's a pretty easy resource they have. So that's that. So is there any treatment for dementia? The hard answer is there's not. But dementia is also a really broad term, so there's a lot of illnesses under that umbrella term. So there are some drugs that can help prevent or relieve the symptoms. So a few of those that we'll just touch on are Aricept, Exelon, Namenda, some you may have heard of, and those really help the chemical messengers in the brain. And like the first group there says it helps in memory and judgment, and then the second group in learning and memory. So there's not really a whole lot of treatment options other than just helping the symptoms. There's also therapy that you can do though if you're thinking that dementia is coming on, or if you already have dementia. A really good thing to do is to you can do occupational therapy to help you kind of remember how to do the everyday tasks that you may have forgotten how to do. Modifying the environment is a big one. If the person's falling or they forget where they are, sometimes to modify the environment, kind of get the tables and the chairs out of the way, can really help them. Modify your responses is a big one. If you're working with somebody with dementia or have family or friends, it's really hard for them to hear that they're repeating the same thing over again, or you already know that, or no, you're wrong, like that's not right. The best thing to do is just kind of to say yeah, kind of accommodate them the best that you can. You can modify the tasks that they're doing, the tasks that you're doing to kind of help them. And then also when they can participate in old pastimes that they've really enjoyed, it can help them remember things that they really enjoyed doing. And prevention, like I said, there are prevention methods that you can do to kind of get yourself to lower the risk of developing dementia or any other kind of brain illness. Maintaining a healthy blood pressure, blood sugar, and cholesterol levels is really good. So the fact that you're taking medication, if you have that, is a good start. Staying physically and socially active is a really important part, because staying socially active, physically active is always important in any kind of health issue, but staying socially active really helps your brain activity, helps your brain health if you're continuing to be socially active. And then that goes along with keeping your mind active. If you're, doing puzzles, if you can, coming to these things is great. Eating healthy is an important part. Don't smoke, that's an important part. Pursue education. This again is a great start for that. And to get quality sleep and reduce and manage stress. I think that's all. Yep. So are there any questions or comments or stories?
So the treatment method will just kind of delay it, like with Alzheimer's. You take some medicine, I understand that might slow it up. It's going to happen eventually, maybe when you're 95 or 100 or something like that, but as you get it in your 80s, something slow it up a little bit.
Yes. Yeah, that's basically right. But if you have already developed it and you didn't take the medication up to the point of developing the disease, it can still help reduce the symptoms a little bit and kind of maybe help jog memory for the time being while you're on the medication.
Is there a way to get a list of those things that it's not on here that dementia that fall under the umbrella of dementia? Is there a way we can get that?
Absolutely.
Today?
Yep. I can
Will
email
that be
that.
on the website?
I don't know if it's going to be on the website. This slideshow is going to be posted, though, I think, with the YouTube page. So that might be on the website. But we can get it to you, definitely. Even if I just have to email you this slideshow, we can get it to you. For sure.
Is the United States worse than other countries with the problem? And if it is, why is it?
Yeah. I don't necessarily think that we're worse from the research that I've done. I think because we're a really populated country, the prevalence is more just because there's more people here. But definitely I think we are a little bit on the bad side just because of our diet. We don't exercise as much as other countries. Some countries they walk everywhere. So they would definitely probably have a lower risk.
We also have a higher life expectancy as well. So with us living longer, dementia is an aging issue, and you consider it more when you're aging. And other countries may not have a higher life expectancy as America does.
Right. I know too that dealing with Alzheimer's patients that you don't disagree with them. That's the worst thing in the world you can do. You just go along with them and say, yes, that's right, you know. Because that makes them angry and it confuses them.
Yeah, exactly. Yeah, that was, in the research that I did for this presentation, that was a huge topic when you're dealing with a loved one or if you're caring for somebody with dementia. That's one of the worst things you can do, because it really is. I mean, it would be frustrating if somebody was telling you that you were wrong all the time, but you genuinely thought that you were right.
Yeah. Regardless if you know they're wrong, you just agree with them.
Right. Yeah. Yeah. Yeah, unless they're trying to drive. You go.
I have an example that my father had it, and he would say, like for instance, isn't that a beautiful red tree? And instead of us answering yes or no, I would go around it like, it's a pretty tree, you know, that's pretty color. Mm-hmm. And this way you didn't have to get in an argument because it sets them on fire when you disagree with them.
Yeah, that's a good story. Are there any more questions or comments?
You know, sometimes they'll know of cases where they will use a crazy word, maybe talking about the flower, and they said, well, that automobile looks nice, doesn't it?
Yeah. Yeah.
I can't find the word. Of course, I can't find the word sometimes.
Yeah, I did see it.
When I don't know what it is.
Yeah. Yeah, with Alzheimer's, I think that's a huge thing, is sometimes if they can't come up with the word, or if they can't think of the word, they'll just come up with a word that kind of seems good to them. And so it's kind of difficult if you're dealing with it, you know, from the caregiving or the family side of it. But you just kind of have to go along with it and accommodate them the best you can.
My brother and me were taking care of my dad, and my brother explained it to me. He said, I didn't see the movie, but I know what it was about. It was 50 First Dates. And something that I've noticed with my dad, especially with the memories, is that, well, my brother lives in Texas, and he just came and visited. And my dad got off the phone talking to him, and 10 minutes later he said, did Tracy leave yet? So that was, my brother was on his mind, but he didn't process anything else.
Yeah.
And I mean, I just said, oh gosh, Daddy, 48 hours. That's all. You know, I didn't correct him. I just, and I found a lot of times asking their opinion, because I teach life skills to teenage at-risk kids, and I find that, you know, we all want to feel significant, and I'm going through menopause. And, you know, there are just times that I just don't get it right, or I'm just moody and all that sort of thing. So we all go through different seasons.
Yeah.
But the question that I had was, my grandmother did forget who you are eventually, but my dad clearly remembers people. I'm just wondering of the different parts of the brain, because he clearly remembers names and people. He just doesn't know where his wallet or his teeth or his glasses are.
Yeah, so there definitely are. I wish I had a picture of it on here because it would match perfectly with your question, but there's definitely different parts of your brain that deal with different memory and personality. Definitely the frontal lobe is your personality, so if that's affected, a person's personality may change drastically. You may not even think it's like the same person, but it's just the part of the brain that it's affecting. I definitely too think that it could be the type of dementia that it is, because some of them, if I could go back to the slide. Yeah, so some of these they do affect the body a little bit differently. So Alzheimer's too is really hard to specifically diagnose, and a couple different other dementias are like that too, that you can't really diagnose them until after the person has passed away and you can look at their brain to see exactly what was going on. So it could be that there was just a little bit of a different type of dementia there.
That was my next question. What actually kills a person? I know their mind, but what actually is when they finally die from it, but what actually happens at that time?
Yeah, that's a good question, and I don't know if I know the exact answer. But this, the next picture, I really think it's just the deterioration of the brain, because this is a very progressed stage of Alzheimer's, but you can just tell the brain has shriveled up almost to nothing. So it's really hard for the body, for the rest of the body to function when the brain is disintegrating that much.
Another thing I've run into, in fact, it was her father. He, a lot of times they won't know other people. In fact, as soon as I got within eye shot of him, he would say, "Hello, Walter." He'd turn around to her and say, "Who are you?" And that's hard on the family. That is extremely hard on the family. And I've known other people where they've expressed that as well. It's hard to, if I don't recognize the family instead of somebody else.
I know. I don't know if I have an answer to that. I don't know if anybody has an answer to that. It is.
I just pointed out how that's
really
a condition that you're going to run into maybe.
Yeah, definitely. That is a struggle with it.
Plaque on the brain.
Plaque, yeah. That's a huge part of it.
Okay, are we looking at any of these that show that?
Let's see. This is not the plaques. This is just the disintegration of the brain tissue at the advanced stage. Let's see if I can zoom in. It doesn't look like there's plaques on this one.
It's more so the aftermath.
Yeah, this is like, if I can get in far enough.
Well, I know when my grandmother had it years and years ago and was diagnosed and her mind was going, they called it hardened arteries of the brain. That was what they called it back then.
Yeah.
They didn't actually have a name, I don't guess, and that's what they called it.
Yeah, and now, I mean, I don't know if they have a specific term for it, because dementia is such an umbrella term. Different illnesses do affect the brain differently. So there's the plaques, there's nerves, there's damage of the tissue around the brain, water buildup in the cavity of the brain. There's a lot of different problems that can evolve from brain illnesses and brain damage.
You know, a lot of times they begin to wonder at night around the house, and the house we previously owned had that situation before we moved there. Well, they had to put the key locks all the way around the outside door so they couldn't get back out at night. I mean, you'd be asleep, and if it's your partner, you may not know. You know, he or she are gone, you know, out rambling around.
Yeah, that would be a tough
I know my aunt told me one time she had developed that. She said, "You know, I woke up last night and I was walking down Georgia 20. I was like, "Oh, I'm reading it now." But other people begin to say, "I saw her walking down Georgia 20 at 2 o'clock in the morning." You know, these things are dangerous.
Yeah, they are.
I do find a sense of humor helps, like what you were just saying. My stepmother, my dad's ex-wife, was his caregiver for a long, long time, and every now and then he slips up and calls me Jane, which I don't like. But I just go, "Daddy, I'm Tammy and I like coffee, remember?" And let's go make a pot of coffee, you know. But I did have a funny story. You do have to have support and friends, because I have a friend who went through this twice with her in-laws. And she told me a story about her father-in-law, who used to be a pastor. This was in Virginia. He used to be a pastor, and he actually visited the nursing homes. That was a part of his ministry. But he had Alzheimer's, and he did live at home because his wife, you know, was his caregiver. And apparently in the middle of the night, about 2 blocks away, he got up in his pajamas and went to the nursing home. And one of the night shift thought that he was a resident and put him to bed.
Oh my goodness.
And the next day, somebody came on shift that said, "Didn't know he was a resident now." And they finally figured it out. And she said they just would always tease and laugh about it. And you know, I guess it does depend on the personality, because we can tease sometimes with my dad a little bit, you know. "Well, Daddy, you know, you're just getting old." I actually said one time, "Daddy, I'm menopausal and you're getting old." I said, "That's the blind leading the blind." Around here.
Yeah. Did you have a question?
Yeah. How long has it been recognized? I know you used to think they were just going routine.
Yeah.
You know, so they weren't medical facilities or nothing.
Yeah. I'm not actually quite sure when it was recognized as an actual illness and disease. I know it's still very difficult for the treatment side of it for them to say, well, here's how we can get you help, because there's still not a lot known about how to cure it. I mean, there's a few prevention methods, but there's a lot more still to be done. And if we could test if somebody had Alzheimer's before they passed away, that would be a huge thing too. But just, it's still very new, and I don't think there's a whole...
Where are the studies concentrated? In hospitals, colleges?
Probably, I would say the ones that I've looked at are all hospitals, and they're concentrated on Alzheimer's because that's the most common. Dementia as a whole is kind of linked to Alzheimer's, but like I said, there's so many more that kind of fall under the same umbrella, but I'm not quite sure.
I know that there's an Alzheimer's Association and all that. You don't hear much about dementia and other things.
Right, yeah. Alzheimer's is definitely kind of the headliner under dementia because it's so common these days. So.
The medical field, doctors, so forth, are they concentrated on that? Is there a heart surgeon of that problem?
I don't. The neurologists typically can look at those kind of issues. However, there are a ton of researchers that focus to study the brain, and because it is a brain issue and problem, so there are specialists that are working on it.
And there are 2 neurologists here at the hospital, so there's a physician referral line on the back if you have concerns about somebody else or for yourself. The physician referral line is on the back of the handout you got today, and they can definitely get you an appointment or hooked up to talk to a neurologist who would definitely have more information than me.
Do you think, does early onset Alzheimer's fall into this category? A classmate I graduated with died at 55 from it, which is young.
Yes, it is.
We didn't know it. He'd been gone a few years before we found it out.
Yeah, it definitely would fall under this. Early onset Alzheimer's is becoming a much bigger problem than it has been in the past. From what I've read, I think it has to do a lot with genetics and family history. Deals a lot about the early onset part of it, but it would definitely fall under dementia.
It seems like the females, of course, they live longer, but there seem to be more women with that problem than there are men.
Yeah, I'm not quite sure why that is.
But we're gaining because we're living a little bit longer.
Yeah, y'all are catching up.
Well, I've always thought it was hormonal.
Yeah, the high estrogen levels definitely has to do with it. That's a risk factor for sure. So that is probably part of it why there's more females that develop dementia or Alzheimer's. But that's really, that's the only thing I can really think of that would increase the risk for women is the estrogen levels.
Right.
Unfortunately. Anybody else?
I've heard sometime at night, in the late afternoon, that it bothers some of the patients. They get more confused.
Don't they call that sundown?
Yeah, sundown syndrome.
Sundown.
And it's not good for changes.
Yeah. Yeah, changes would definitely be hard, I think, for anybody with dementia just because they like what they're used to and that's the most comfortable thing for them.
That's their routine and that's keep them in it.
Right, right.
A lot of the older, a lot of the seniors, we'll put it that way, have problems sleeping or staying asleep, and the quality of your sleep is really impacts a lot. I don't give it a couple hours sleep, I don't think as well. If I ever think well, I don't think as well.
Yeah, sleep is a huge part of almost every health problem that we have to deal with. So getting a good night's sleep has really been pushed the past few years to increase health status and decrease the risk for a lot of diseases and illnesses.
And how about taking sleeping medication? Is that?
As far as I know, it's not affected by that. So if you do take medicine to help you sleep, it still helps your health by you getting that sleep, whether it's by medication or not. As far as I know.
When I get my dad's vitamins at night, I have melatonin in there. And I need to ask when we go back, valerian root is more for nerves. And so I need to ask him, you know, if maybe during the day, throughout the day, you know, if that might have calming effect.
Yeah.
Sometimes it works, sometimes it doesn't.
Yeah, melatonin is a good, more natural, like you said, vitamin supplement that helps regulate your sleep cycle. So some people like to try that before they get on prescription medication.
Well, babies are full of it. That's why we sleep all the time. And say as we get older, we have less and less and less. And one thing I did diet-wise is I changed his oils. Like instead of fried chicken with Crisco, I make it with olive oil. And I have a shake if I can get him to drink it sometimes that has coconut oil in it. But now I have coconut, those things, because he doesn't like it.
Yeah. Now, I read an article or something here a while back since you mentioned the coconut oil, and they were stressing that if you would give, I guess, the Alzheimer's patient or the dementia patient like a teaspoon or several teaspoons throughout the day of the coconut oil, that it improved their memory and things.
Wow.
But now I think if you quit giving it to them, then they just relapse, you know, it wouldn't be as good.
That's interesting. I haven't read about that, but it would definitely be something to look into. And if that works, I think it'd be a huge step in the right direction.
There are a lot of studies based on coconut oil. Some of them are iffy, some of them, you know, promising, but it just takes like more time with more research, because I've read the complete opposite for that as well as that as well. So it's just finding the right resource and evidence to back it up.
And if it might work for one, it might not work for another.
Exactly. It depends
Well,
on
one
the
thing that
sample.
never fails is water, because whenever I taught special ed, we actually did an experiment. Our kids, of course, most of them were ADHD, and they couldn't sit still and they didn't want to read a book. They were tactile learners, and so something that we did is the special ed teacher I worked with, every morning we would walk around the building to get the endorphins up, and we would hand them all a bottle of water, and their grades actually went up.
Wow.
We didn't document it, but when you drink water, you hydrate your brain. That's sort of like a dry sponge would be your brain without water. That was what we used to tell the kids.
And we as Americans don't drink enough water in general.
So more water.
Yeah.
Keep them hydrated.
Yeah, and that's good for any health issue. Definitely more water, and I know I could definitely work on that too. It's hard sometimes.
But as y'all see, like a lot of the health issues are intertwined. It's a very complex issue, and it's a like multi-level issue. It comes from family support, the individual, what part of the brain. So it's just important to remember all of those aspects if you encounter it.
All right, well, thanks for coming out. We'll let y'all get out of here now. We had a great turnout, so thanks for coming. And we're going to see you next month.